doctor, but nurse practitioner. Do you know who nurse practitioners are? Those who studied for nursing and then decided to move forward. Thank you so much for having me today. And of course, good morning, everyone. We're gonna have a short series, maybe once a month, maybe twice a month. We'll see. And the name of our series is gonna be Nourish and Flourish. But before we start, I just wanted to introduce myself and just let you know who I am so you will know me better. So I'm a nurse practitioner for the last 8 years, but I've been in the medical field for the last 13 or 14 years. And you know, I worked in different settings, treating different patients. And you know what's interesting? I've seen a lot. I've seen people dying. I provided countless of CPRs. I've seen people getting better and living their life. But you know what I have never ever seen in my life? Actually, I did, but maybe 1 or 2%. People never get better if they get any chronic conditions. So let's say they got diabetes. I have never seen this person get off medications. If you got high blood pressure, this is it. For the rest of your life, you're getting those medications. Have you ever seen a person getting better once they got any chronic conditions? Let's say COPD, asthma, arthritis. That's it. That's our destiny. Is it? Is it our destiny? So I want to tell you a little bit more than just medications. And today that's what we're going to talk about. Because what our plan, what is our goal, is actually to get healed. And you know how many nutritional hours medical school gets? Through 12 years of studying? 4 hours. 4 hours. Do you know how many hours I, as a nurse practitioner, got in terms of nutrition and how our nutrition can help us? Do you know how many hours? 0. 0. So if you are not interested in this field and if you just trust in your Western medicine doctor, well, your options are limited. It's just the medication. And I'm going to give you an example. Many years ago, when I just came to this country, I got very, very sick. I was coughing, I had fever, and I was not getting better. So I decided to go to the doctor. So I got into the office, and after maybe 30 seconds of our talk, she said, okay, I'm giving you antibiotics, bye. And I said, oh, why antibiotics? Maybe some herbs. You know, I'm from Russia. We do, drink herbal tea. And she said, well, I'm not a professional in herbs. Okay, this is it. I have to tell you that Western medicine got really, really great at treating conditions like cancer, acute conditions, let's say pneumonia. You know, in my facility where I work right now, one patient has pneumonia. If I caught it on time, 5 days later, great, no symptoms. Patient got better. So we're really good with antibiotics. We're really good with acute conditions. But with chronic conditions, not so well. So today, I want to talk about high blood pressure. You don't have to raise your hand, but I'm pretty much sure you know someone who has high blood pressure. Maybe you know someone who have 1 medication, or maybe patient takes 2. Probably 5 within 10 years, because then legs get swollen and, you know, we need more and more medication. And as I said, we rarely seen anyone who get better from chronic conditions. So let's see if my clicker is working. Here we go. High blood pressure. Just listen to this statistic. So in United States, nearly 78 million people have high blood pressure. That is about 1 in 3 American adults. So it's like 1, 2, high blood pressure, 1, 2, high blood pressure. Can you imagine? Once you have been started on blood pressure medication, likelihood that you will stay on this medication for the rest of your life. Many people, including doctors, are led to assume that high blood pressure, like wrinkles or gray hair, is just an inevitable consequence of getting older. Okay, I'm 40, my high blood pressure is right here. I have to start on medication. Well, arthritis is here. I have to start taking my Motrin. You know, we got used to it. It's normal for us to kind of, I'm sick now. Is it normal? Do you think it's normal? So let's talk about this high blood pressure and what it is and what's going on in our body. And maybe we can help ourselves. And if we, thank God, don't have the high blood pressure now, maybe we will never have it. If we will just adjust a little bit of something in our life. So let's take a look. What is high blood pressure? So we all have blood vessels. And those blood vessels all over the place. And blood vessels inside has an epithelium lining, beautiful lining. And this specific lining helps our blood to flow. And our blood vessels are pretty straight, so blood is working, pumping throughout the body. So what happens when this lining gets inflamed? And why it gets inflamed? Unfortunately, because of the stuff we eat. It's due to smoking, obesity, high intake of processed food, animal products, and so on. So once we have something that our body doesn't like, our blood vessels put oil on it, and butter, and Band-Aid. And look what's going on. You can see it on the slide. You see this yellow stuff inside? It forms plaque. So now our lining inside of our tubes is not so nice and straight. It actually has some bumps on the road. Do you think blood will actually go freely through those pipes? Well, until certain time, I would say. It will flow well, but then it eventually will develop into, it's a progression of the disease. So those plaques become more until it grows and rupture, and then we get a blood clot. Oh, I hope we will never ever get this blood clot. So how we normally treat the high blood pressure here in America? We have a bunch of medications, tons of medications, and that target specific organs, target kidney or heart itself or blood vessels, that just tells our body, okay, don't raise blood pressure. You took this medication, this is it. So let me tell you, we have different, this is just a little bit, some quick overview. You don't have to memorize it, just to get an idea. So we have ACE inhibitors. Those ACE inhibitors, they block certain enzyme in kidney and tell, don't vasoconstrict, don't. Keep it relaxed. Then, if this one doesn't work, we usually put on ARBs. ARBs, it's also targeting kidney. It's just affecting another receptor in the kidney, basically telling the same thing. Then we have calcium channel blockers. Who are those? Those are calcium that basically, those pills, they block calcium from entering cells, and this is what happens with our blood pressure. It gets lower. Beta blockers is a specific receptors in the heart that when we block it, it artificially reduces our heart rate. Now, let me ask you, after we all do this with our kidney, with our heart, with our cells, do we actually get healed from blood pressure? No, we just push in our body telling, no, don't do it. It's similar to, for example, if we are thirsty and we want to drink water, we're like, nope, I'm not thirsty. I'm not thirsty. I'm not thirsty. I'm going to eat something. I'm not thirsty. Well, will it help? Probably not, right? So that's what happens with us, because most of the time, those medications at some point, they stop helping. And you cannot imagine how much time I spend sometimes have to play with those medications. Okay, this medication doesn't help. Another medication. Let's reduce the dose. Let's increase the other dose. And blood pressure is still not under control. Why? Because nothing changed inside of our blood vessels. They have been blocked and they are still blocked. So, what we need to do to help ourselves? It's actually very, very easy. And it's not just easy, it's delicious what I'm gonna tell you. It's amazing stuff that we can change in our life to actually feel and be healthy and get off all those medications. I'll give you one example. I just recently had a patient, 40 years old, high blood pressure. So blood pressure goes up to 155/100. Not obese, not heavy guy, standard. And I said, okay, let's just make some changes. Are you willing? He said, yeah, I'm willing. In a month, his blood pressure became 110/60. You say miracle. Not really. He stopped putting some stuff in the mouth that shouldn't, and he focused more on the good stuff. And our body wants to get healed. So once we put right stuff in our mouth, our arthritis is gone, our blood pressure is better, our kidney working better, we are low risk for cancer. Isn't it amazing? And I'm going to tell you, it's very, very easy. So what we actually need, we need antioxidants. What is antioxidants? Antioxidants and phytonutrients. What is this? Berries, nuts, fruits, veggies. Now, don't answer, but think. How many fruits or veggies, or how big was your salad yesterday? So if, we have this, apple a day keeps doctor away. Oh, this is a lie. Don't listen to it. 1 apple a day does nothing. Nothing. You need to have not just 1 apple a day, but a cup of berries and big salad, huge salad filled with kale and tomatoes and all this delicious stuff that God created for us. So this is what our diet's supposed to be. But I want to ask you something. I want to ask you something to try this week. Very easy. And I said delicious. My kid loves it. And what I want to ask you, if you have a blender, if you don't buy it, I'm going to ask you next time if you got it. If you have a blender, make yourself a smoothie. Do you guys like smoothies? How often you drink it? Let's make a deal. Let's drink smoothies this week every day. And I have to tell you, if you put kale in it, flax seeds, banana, berries, get frozen berries, they don't spoil that quickly, or mango, or pineapple, add a little bit of water and blend it. Oh, this stuff is heaven. It's amazing. And you won't believe it. Once people start eating lots of fruits and berries and reduce their intake of processed foods, milk, and cheese, you get changes within days. Within days. So, you guys, I know you want to be healthy. And my proposition to you, try. If you don't have blender yet, get the blender. Because we're going to talk more about healthy stuff. We're going to talk more about different diseases. We're going to talk more on personal level. And we're going to learn more about our diseases, that some chronic diseases, you don't have to get it. I'm almost 44 years old. I do not want to have blood pressure when I'm 54. I want to run when I'm 64. I want to be able to see, different countries when I'm 74. And God gives us this capability, but it's up to us how we use it. And I have faith in you. Thank you.